Hello and welcome to the Nutrition for a Healthy Liver class. Brought to you by the registered dietitians at Cambridge Memorial Hospital. In today's class, we'll talk about the liver's role in nutrition and health. We will talk about lifestyle changes that can help us reverse or enhance our liver health and prevent any further injury. Our liver is the largest organ in our body, performing over 500 activities. When it comes to nutrition, the liver plays a vital function. It aids digestion by creating bile salts, metabolizes carbohydrates, proteins, and fats, aids in the absorption of fat-soluble vitamins, and stores nutrients for later use. Our liver makes different proteins like albumin, which helps keep fluid from leaking out of our blood vessels into other tissues. The liver is also responsible for producing coagulation factors, which helps with our blood clotting. The liver helps produce and regulate hormones such as converting thyroid hormone to its active form and producing hormones which help regular blood pressure. Our liver breaks down old red blood cells and helps get rid of them in the form of bilirubin. Additionally, the liver also plays a large role in detoxifying and breaking down toxic poisons, drugs, alcohol, and waste products from the body. The liver can regenerate itself. As long as at least 25% of the healthy liver remains, it can become whole again. Fat stored around our organ is known as visceral fat. If fat builds up to more than 5% of the liver, then the liver is considered to be a fatty liver. How does the fat get there? The liver and other organs normally break down fat and sugars from a person's diet. If the amount of fat or simple sugar consumed exceeds what the body requires, the excess fat is stored in the body as fatty tissue, including the liver. There are different types of fatty liver disease. NAFLD stands for non-alcoholic fatty liver disease, and is a liver disease affecting people who drink little to no alcohol. As the name implies, the main characteristics of NAFLD is too much fat stored in liver cells. NAFLD is the most common liver disease in Canada, affecting about 20% of Canadians. MAFLD stands for metabolic-associated fatty liver disease. It is similar to NAFLD in that it has excess fat around the liver as well as the presence of another risk factor such as obesity, prediabetes or diabetes, elevated blood pressure, high triglyceride levels or low healthy cholesterol. A more severe type of NAFLD and MAFLD is NASH or MASH, which can also happen to people who consume little to no alcohol. Not only can NASH/MASH induce liver scarring, known as fibrosis, but 1 in every 5 persons with NASH/MASH may have possible hepatic function deterioration known as cirrhosis. This picture shows the progression of liver disease. As you can see, liver disease can be reversed while it is still in the early stages and is irreversible after it has progressed to cirrhosis. To help treat liver disease, preserve liver health, and stop further liver damage, lifestyle adjustments are crucial. Risk factors for fatty liver include metabolic syndrome, which means having a few different risk factors. Large waist circumference, high blood pressure, high blood glucose levels, high cholesterol. Obesity is another risk factor for NAFLD. Or being at a healthy weight but having a large waist circumference. For men, a waist circumference greater than 40, and for women, a waist circumference of greater than 35 inches. High intake of saturated fat and simple sugar. Large portion sizes. Genetic factors. And liver injury caused by drugs and chemicals. Risk factors for NASH or MASH include a previous history of NAFLD, as well as type 2 diabetes, cardiovascular disease, obesity and genetics. People with these liver conditions generally have limited to no symptoms, which is why it often goes undiagnosed. Some people will experience discomfort or tenderness in the abdomen, fatigue or a general unwell feeling. Fatty liver disease is usually suspected in people who have the risk factors discussed earlier, such as being overweight or having a large waist circumferences, high cholesterol, or abnormal liver tests in their lab work. An ultrasound or fibroscan of the liver can show the presence of a fatty liver. In some cases, your doctor may advise a liver biopsy, a procedure where the physician inserts a needle into the liver and extracts sample tissue, which is then examined under a microscope. The treatment of fatty liver disease is related to the cause and involves treating the risk factors such as obesity, diabetes, high blood pressure. There is currently no medication-based treatment for NAFLD and NASH. There are multiple clinical trials underway for various NASH treatments, as well as several promising pharmacological therapies that are expected to pave the way for new and more effective treatment alternatives. Many people struggle with weight management and have tried various methods to lose weight, often with success but unable to sustain the weight loss. Weight loss can seem daunting, but evidence suggests that even moderate amounts of weight loss achieved through long-term improvements can greatly improve liver function and reverse other metabolic risk factors such as prediabetes, hypertension, and high cholesterol. 5% weight loss can reduce fat and inflammation in the liver. 7% weight loss has potential to resolve NASH. 10% weight loss can reverse or stabilize fibrosis. Achieving a healthier weight is not a quick fix. It is a marathon rather than a sprint. It requires a change in behavior and consistent effort. The nutrition strategies that will be discussed in today's session will help with weight management and form the building blocks to a healthy lifestyle. The shift towards obesity management is now focusing on the concept of best weight. Your best weight is the weight that you can achieve while living the healthiest lifestyle possible. Consult a dietitian for advice on the best approach and strategies to help you manage your weight. Following a balanced healthy eating pattern will make it easier to stay consistent and maintain healthy eating changes in the long term. Eating a variety of foods from different food groups helps provide our body all the nutrients it needs. Skipping meals can lead to excessive hunger. Entering a meal when we are famished is more likely to result in overeating and not making the best food choices. Paying attention to our hunger and satiety cues can help keep our body in a comfortable zone. It is important to portion our foods instead of eating directly from packages. Larger supersize packages lead to larger portions of that food being consumed. This is also true for any product. We are more likely to use larger amounts of toothpaste and shampoo if using a larger bottle compared to from a smaller one. Planning our meals and making a shopping list before going grocery shopping will help us stay on track with the types of foods we purchase and also help avoid impulse shopping. Stick to your grocery list and don't go down aisles you don't need to an item from. Have a snack before you go grocery shopping, since we are more likely to buy high-calorie foods items when we shop while feeling hungry. Out of sight, out of mind can be helpful for some people when it comes to high-calorie snack and desserts. Instead, keep healthier snacks more accessible for easy grabs. For others, it is easier to not purchase these types of foods and instead go out for single-serving snack or treats on occasion. Whichever approach works for you, keep the 80-20 rule in mind. 80% of the time try to make nutritious whole food choices and 20% of the time enjoy treats and snacks as part of healthy eating. Many people are used to multitasking, which means doing other things while eating. This could be working on a computer or watching TV. If we are distracted while eating, we are more likely to overeat. Many people continue to eat until the plate is finished even though they were full half through the meal. Practice mindful eating by taking 20 minutes to enjoy your food without any distractions. Tracking our food, activity, stress, and sleep can provide us valuable insights that help in making behavior change. We cannot change a behavior unless we are aware of it. Tracking can help identify high-risk eating times and triggers for eating. It can be a helpful tool to increase our awareness and accountability to behavior change. A part of mindful eating is to understand our hunger and satiety cues. What does it feel like when you start to experience stomach hunger? What does it feel like to be comfortably satisfied versus feeling full or stuffed? We should practice this through the day and at all eating occasions to help us gain insight into the signals our body gives us. This will help us use hunger and satiety as a guide to our eating. Even in the absence of weight loss, physical activity has been found to benefit liver health. Aside from the benefits to our liver health, physical activity can help manage and prevent chronic diseases such as diabetes and hypertension, boost healthy cholesterol, and reduce stress. The goal for physical activity is get at least 150 minutes per week or 30 minutes most days of the week. Adding physical activity to our daily routine, such as taking the stairs instead of elevator, parking further away, or getting off at an earlier bus stop, are all great strategies. But it is also important to have a set duration of exercise most days of the week where we work on getting our heart rate up. This could be going for a walk at a good pace, using a stationary bike indoors, or a more structured exercise program or class at a gym. It is also beneficial to include strength training exercise a few days a week. The remainder of this presentation will focus on nutrition strategies for improving liver health. There is no specific liver health diet, rather it's a healthy eating approach that will benefit not only our liver but also provide more energy, prevent chronic diseases, help achieve and maintain a healthy weight. A balanced healthy eating pattern can overall makes us feel better. The key guidelines to follow to help our liver function its best include reducing intake of sugar, increasing intake of fiber, reducing intake of saturated and trans fat, avoiding alcohol, reducing sodium intake, eating a well-balanced diet, for example, Mediterranean diet. Let's discuss these in more detail. Reducing intake of sugar or simple carbohydrates is important for liver health. Simple carbohydrate are sugars, especially added sugars, which can be found in the form of raw sugar, white sugar, brown sugar, corn syrup, glucose, fructose, etc. The most common sources of sugar in our diet are sugar-sweetened beverages, coffee, tea, juices, sodas, baked treats and packaged treats, cookies, cakes, pastries, chocolate, etc. Fruit juice, breakfast cereal. Added sugars should make up less than 10% of the calories we eat. On average, this means less than 9 teaspoons sugar for men and less than 6 teaspoons sugar for women. The following suggestions will help you get started on reducing the quantity of sugar in your diet. Avoid adding table sugar and brown sugar to foods and beverages. Choose water over sugar-sweetened beverages. Pick fruit over juice. Enjoy fruit and vegetables for snacks. Choose plain yogurt and add fruit and nuts, seeds for flavoring. Try nut butter or avocado on toast. When selecting cereals, limit the sugar to no more than 8 grams per serving. Reduce your intake of sweets and desserts. Avoid all or nothing thinking, which can often lead to more cravings. Instead, try the 80-20 rule, which means 80% of the time choose healthy whole foods and 20% of time enjoy your treats as a part of healthy eating. Understanding food labels is an important step to healthy eating. Follow these 2 steps to determine how much sugar is in the foods you eat and where the sugar is coming from. First, look at the nutrition facts table. Is there less than 5 grams of sugar per serving? If yes, that food is lower in sugar. If no, then proceed to step 2. If there is more than 5 grams sugar per serving, you want to question whether that sugar is naturally present or added as extra sugar to that food. See if the word sugar, or another word referring to simple sugars like dextrose, fructose, or glucose, is present in the ingredient list. We should choose complex carbohydrates more frequently than simple carbohydrates. Complex carbohydrates are made up of sugar molecules that are strung together in long, complex chains. They're higher in fiber and digest more slowly. This also makes them more filling, which means they're a good option for weight management. Complex carbohydrates are classified into two types: fiber and starch. Examples of complex carbohydrate include whole grains like quinoa, barley, buckwheat, oats, wild rice, as well as other foods like fruit, vegetables and beans or legumes. Fiber is a type of complex carbohydrate. Fiber is especially important because it promotes bowel regularity and helps to control cholesterol. Fiber helps reduce portions of food by providing satiety. It also helps stimulate growth of healthy bacteria in our digestive system. The main sources of dietary fiber include fruits, vegetables, nuts, beans and whole grains. Other ways to increase fiber in your diet include adding ground flax seeds, chia seeds or bran to cereal, oatmeal, yogurts and to your baking. Psyllium fiber such as Metamucil can be added to water and consumed with meals. It's important to increase fiber intake in your diet gradually over a few weeks. Too much fiber suddenly may cause gas, bloating or cramping. Also drink plenty of water with fiber to prevent the stool from coming too bulky and dry. Fat is another important nutrient for our body. It helps absorb fat-soluble vitamins like vitamin D, makes hormones, protects our organs and gives flavor to our food. However, too much fat or the wrong kind of fat can be damaging to the liver. Therefore, both the quantity and quality of fat we consume matters. Saturated and trans fat can cause cholesterol to build up in your arteries, blood vessels. Saturated fats raise your LDL, bad cholesterol. High LDL cholesterol increases your risk for heart disease and stroke. Diets high in saturated and trans fatty acids also cause an increase in liver fat and insulin resistance. Trans fats are found in many processed snacks, fried foods and frozen food items. Health Canada has banned artificial trans fat, making it illegal for manufacturers to add partially hydrogenated oils to foods sold in Canada. Although this is a good change, keep in mind that this does not make processed foods healthier to eat, since these foods can still be high in sodium, saturated fat or sugar. Instead of saturated and trans fats, we should choose fats that unsaturated more often. Unsaturated fats improve blood cholesterol levels and reduce inflammation along with a number of other benefits. Unsaturated fats are mostly found in plant-based foods, such as vegetable oils, nuts, and seeds. Fish contains the healthy omega-3 fats which we will discuss later. One in every 4 Canadian adults consumes more fat than is recommended. To be able to control our fat consumption, we must first understand where the fat is in our diets. Sometimes fat is easy to spot. In the butter, oil, margarine or mayonnaise we add to foods or use in cooking foods. The fat on the outside of foods like the skin on chicken and the trim on meat, these are easily removed. Sometimes fat is hidden. We use fat as ingredients in foods, in recipes, in baked goods, and in many processed food products. We use fat to cook foods. This fat gets absorbed into foods and increases the fat content as seen in fried foods. The following strategies will help reduce unhealthy fats in your diet. Choose leaner protein source such as chicken, fish and plant-based proteins more often. A good rule of thumb is to include fish twice a week, especially fatty fish like salmon and trout, plant-based protein 1 to 2 times a week, and then poultry for the remainder of the week. Limit red meats to maximum once per week. Keep portions of animal-based protein to 3 ounces, which is about the size of a deck of cards. Plant-based food protein includes beans, lentils, tofu, nuts, seeds. There are many delicious recipes available online including on lentils.ca. Avoid processed and high-fat meats such as sausage, bologna, salami and hot dogs. Deli meats should also be limited to maximum once a week due to its high sodium content. Choose lower-fat dairy products such as 2% milk fat or lower milk and yogurt and less than 20% milk fat cheese. Have cheese in moderation such as no more than 3 buy per week. Use healthier oils such as olive oil in cooking and try using cooking methods that require little to no oil like steaming, baking, grilling and poaching. Choose snacks carefully since snack foods like chips, crackers and baked goods are often a high source or unhealthy fats. There are 3 types of omega-3 fatty acids. ALA found in plant sources, EPA and DHA found in marine sources. Omega-3 fatty acids have numerous health benefits, including improved brain health, heart health, and reduced cholesterol and inflammation. In persons with NAFLD, omega-3 fatty acids may help reduce liver fat and inflammation. Plant sources provide us with ALA, but our bodies can only convert a little ALA to EPA and DHA. This is why it is important to include marine sources in our diet every week. There are a few food sources of omega-3 fat. Ground flax seeds are one example of a plant food high in ALA. Omega-3 eggs are another source of EPA, DHA since chickens are fed an omega-3 rich diet, such as flax seeds, and chickens can convert ALA to EPA, DHA. Marine sources are high in EPA, DHA. These include salmon, trout, sardines and tuna. Eating about 5 ounces of salmon once a week helps meet your daily omega-3 requirement for the week. Less than a third of our calories should come from fat, and only 10% of that should be from saturated fat. On average, this translates into about 65 grams of fat per day and a maximum of 22 grams of saturated fat per day. Remember that since all fats are calorie heavy, you'll need to use even the healthier fats in moderation. One teaspoon of oil equals about 4 grams of fat. Let's practice identifying the type of fat in your food, and how to change it to make it healthier and lower in fat. Which of these pasta or noodle dishes is lowest in fat? There are 4 different pasta meals. A homemade fettuccine alfredo, pasta with tomato and meat sauce, chow mein noodles, macaroni and cheese. The correct answer is pasta with tomato and meat sauce has the least amount of fat. Hidden fats are frequently what increases the overall fat in our diet. The fettuccine alfredo is high in total and saturated fat due to the cream, butter and Parmesan cheese. Similarly, the macaroni and cheese will contain butter, cheese and high-fat milk or cream, while the pasta with meat sauce contains fat coming from the meat only. The meat sauce can be further adjusted by using leaner meats or even ground poultry to lentils to substitute for red meat. The chow mein noodles may use a plant-based oil in preparation but can still be high in fat due to the amount used to prepare them. Try making the sauces with lower-fat milk products to reduce the fat. For example, use skim milk or 1% milk when making a cheese sauce or use whole milk instead of cream for the Alfredo sauce. When selecting grain products, choose whole grains, such as whole wheat, oats, barley and rye, more often as they provide additional fiber. Here are 4 salads. A garden salad with vinegar or lemon juice and herbs. A Caesar salad. A Greek salad. And a garden salad with a tablespoon of Italian dressing. Which one has the highest fat content? Which has the lowest fat content? The correct answers are: the highest is the Caesar salad and the lowest is the garden salad with vinegar or lemon juice. Choose salads with care since many may have as many calories or even more fat than other food choices. Let's discuss types of salad dressings and how they influence the fat content. Creamy dressings like Caesar dressing would be higher in fat due to the anchovies, mayonnaise and oil. Plus there are croutons, Parmesan cheese and bacon ingredients in the salad. Most of these contribute saturated fat with the exception of the anchovies. The Greek salad contains oil, olives and feta cheese which all contain fat. But most of these ingredients are unsaturated fat with the exception of the feta cheese. When people think about decreasing fat or calories in their diet, they often choose a salad. Although eating more vegetables is very important, we need to be careful with what we add to our salads and vegetables. You can reduce the fat amount by measuring how much dressing you use, having the dressing on the side and dipping your fork in for every bite, or by making your own healthier fat dressings with vinegar or lemon juice and olive oil. Adding a variety of raw vegetables to your salad will also increase further the fiber and vitamin content of the salad. Alcohol can have many negative effects on our health which include causing weight gain, increasing triglycerides, a fat in our blood, and developing several chronic diseases. Alcohol harms our liver since it has the crucial task of metabolizing and expelling alcohol from our bodies. It is advised to avoid drinking alcohol if you have fatty liver disease. If you do choose to drink, limiting to a maximum of 2 drinks per week. 1 drink is equivalent to a 12 ounces beer, 5 ounces wine or 1.5 ounces hard liquor. Let's discuss sodium next. Sodium is a mineral found in salt. Too much sodium can cause liver dysfunction, water retention and inflammation. A diet high in sodium can lead to high blood pressure, heart disease and stroke. Most Canadians eat double the recommended amount. It is important to note that foods that don't taste salty can still be high in sodium. The recommended intake of sodium is 1,500 mg per day. The upper tolerable limit is 2,400 mg while the average Canadian diet consists of 3,400 mg sodium per day. What does the upper limit of 2,400 mg look like? A teaspoon of salt contains 2,400 mg of sodium. It is important to note that all types of salt contain sodium. Therefore, having a sea salt or kosher salt or Himalayan salt does not provide any added benefit when it comes to sodium. Since achieving 1,500 mg sodium can be very challenging without affecting our nutritional intake, the recommendation for liver health is aim for less than 2,000 mg of sodium per day. Where does all the sodium come from in our diet? We can see in this chart, only a small percent comes naturally from food or even from the salt we add during cooking. Majority of the sodium comes from processed foods. The top 6 sources of sodium in our diet are bakery products, appetizers and entrees, processed meats, cheese, soups, sauces and condiments. Let's discuss some strategies to help reduce sodium intake. Firstly, we should try to eliminate the obvious sources of sodium. This is the sodium we can see. For example, the salt shaker at the table. Salt added in cooking. Foods with visible salt like pretzels, crackers, chips and nuts. Salt preserved foods like salted cod. And foods preserved in brine like pickles. When preparing foods at home, cut the salt in half or altogether and instead experiment with herbs and spices. Second, we should look for hidden sources of sodium in our diet. Pay careful attention to how often you eat foods from these categories. Fast foods, restaurant foods, frozen dinners or entrees, breaded meats, fish and meat pies or fresh meats labeled as seasoned. Deli meats, processed and smoked meats. Dry soups, mixed and canned soups. Condiments. Canned foods. Cheese and buttermilk. Try to eliminate or minimize intake of these foods as much as you can. Thirdly, when shopping, practice reading the ingredients to familiarize yourself with sodium sources. The higher the sodium-based ingredient on the list, the more sodium that food product will contain. Can you find the salt in this label? Monosodium glutamate, salt. Calcium disodium, disodium inosinate, disodium guanylate. The following guidelines can be helpful when comparing food products to help make a lower sodium choice. Less than 200 mg sodium per serving is the best choice. 200 to 400 mg sodium per serving should be used in limited amounts. More than 400 mg sodium is best to avoid. Some other tips to reduce sodium intake include reading the nutrition facts table, which we will discuss in more detail shortly. Try to cook and prepare your own foods at home as often as you can. Experiment with herbs and spices to flavor your food. There are many spice blends without sodium available in stores for different types of meats and dishes. Avoid pre-seasoned meats, poultry and seafood. Rinse canned beans and vegetables with water or look for no added salt varieties. Pay attention to serving sizes even if a food is low in sodium, since multiple servings of a food or different processed food through the day will still add up in total sodium. Unsalt your snacks by choosing unsalted versions of nuts, seeds, crackers, pretzels, as well condiments like soy sauce, salad dressings, barbecue sauces. This table provides a comparison of food products and lower sodium alternatives. For example, 1/2 canned green beans contain 260 mg sodium while fresh green beans contain almost zero. 1/2 cup tomato sauce can contain 750 mg sodium while the same amount of fresh tomatoes or no added salt canned tomatoes is only 10 mg. Salad dressings can contain a high amount of sodium for a very small portion. Try making your own dressing at home with vinegar and oil. Learning how to read and understand nutrition labels is very important for healthy eating. Nutrition facts tables help you choose healthy foods, compare similar foods, look for foods with more or less of a specific nutrient, choose foods for special diets. When looking at a nutrition facts table, it is important to look at the serving size first. The nutrition information provided is for the serving size listed. If you eat half the serving size, you would divide the nutrition information by a half. If you have double the serving, multiply the nutrition information by 2. The percent daily value helps to gauge if the food is a high or low source of a nutrient. 15% or more is a lot. 5% or less is a little. Certain nutrient, fiber and vitamins and minerals, we would more of, so we would look for 15% or more. While sodium or saturated fat we want less of, so we would look for 5% or less. Let's practice reading and comparing food labels. First, look at the serving size. Cracker A has a serving size of 9 crackers while Cracker B is for 4 crackers. If we compare the weight in grams, both crackers are similar in weight, with Cracker A being 23 grams and Cracker B being 20 grams. This is because Cracker A is a smaller size, which is why it has a larger serving size to make the same weight. Since the serving size is similar, we can now compare the nutrition facts. The calories on both products is the same. Cracker A has 13% saturated and trans fat, which is the unhealthy fat, while Cracker B has only 2%. Sodium is also higher in Cracker A at 12% compared to Cracker B at 4%. Fiber is lower in Cracker A at 4% while Cracker B has 12%. So based on this comparison, Cracker B is the better option. Next, let's compare these two yogurts. One is a blueberry yogurt with 2.5% milk fat. The other product is a low-fat blueberry yogurt. Which yogurt should we choose based on the nutrition information? The second product has less saturated fat and comparable sodium and sugar, so it would be the better option. Healthy eating for liver health means enjoying balanced meals. What does a balanced meal look like? A balanced meal or balanced plate means eating a variety of foods from all food groups. Our plate should consist of 3 of the core food groups: a whole grain, a lean protein, and fruits and vegetables. As you can see in this plate, the largest quantity is vegetables and fruit, making up 1/2 the plate. This is followed by 1/4 of the plate with lean protein and 1/4 of the plate as whole grain. Choose water as the best beverage for hydration. Healthy eating is more than the foods we eat. It is also about where, when, why, and how you eat. Here are some key points to include as part of your healthy eating strategies. Be mindful of your eating habits by taking the time to eat your meals and snacks without distractions. Use hunger and satiety cues to guide your portions. It is best to enter an eating occasion when starting to feel hungry and stop eating when feeling comfortably full. Try to plan meals to help you cook more often at home. There are many apps that can help with meal planning organization, provide recipes, and help generate grocery list based on the ingredients needed. Try to involve family or friends when possible to help making cooking easier by assigning tasks or even taking turns in who will cook. If you live alone, consider partnering with a friend to take turns to cook and share meals. Freeze extra food made at home for another day. Don't forget to enjoy the food you eat. Healthy eating should be tasteful and enjoyable. We don't just eat for nutrition. Food plays an important role in our traditions, celebrations, and social events. Eat meals with others if and when you can. Eating meals together helps us try new foods and makes mealtimes more pleasant. This can also be very helpful if you are struggling with a poor appetite. As discussed earlier, eating more vegetables and fruits, whole grains, and lean protein helps provide our body the nutrients it requires. Try to include plant-based proteins more often and choose foods with healthy fats. Limit highly processed foods. If you choose these foods, eat them less often and in small amounts. Prepare meals and snacks using ingredients that have little to no added sodium, sugars, or saturated fat. Choose healthier menu options when eating out. Make water your drink of choice. Replace sugary drinks with water. There are many different dietary patterns that can be beneficial for our liver health. The Mediterranean diet is one that has been extensively studied and shown numerous health benefits, including for reversing metabolic syndrome, brain health, and depression. The Mediterranean diet is not a diet per se. It is actually a pattern of eating or even a lifestyle. It is based on the dietary patterns of several countries in the Mediterranean. A meta-analysis of several studies has shown the Mediterranean dietary pattern to reduce risk of metabolic syndrome by 31%. As discussed earlier, many of the risk factors for metabolic syndrome contribute to liver disease. As mentioned, the Mediterranean diet is a lifestyle and it incorporates many of the strategies we have discussed today. There is no one way to eat the Mediterranean diet. You can start by including some components of it and grow from there. The Mediterranean diet includes eating smaller portions of higher quality nutrient-dense foods. focuses on trying to eat foods in season and fresh as often as possible, and cooking at home to help avoid ultra-processed foods. The Mediterranean diet emphasizes plant-based foods. Similar to what we discussed, by making half your plate vegetable and fruit, a quarter whole grains, you will already be following an aspect of the Mediterranean diet. Try to include 2 servings of fruit, at least 3 servings of vegetables every day. A serving of fruit is 1 medium fruit or 1/2 cup. A serving of vegetable is 1/2 cup cooked or 1 cup raw. Include a handful of unsalted nuts and seeds will also provide fiber and healthy fats. Choose lean protein and plant-based proteins like beans, lentils and legumes at least 3 times a week. Try adding beans to your salad, lentils to your soups, or try a lentil sloppy joe. Enjoy fatty fish like salmon, trout and tuna twice a week to help you get your omega-3 fatty acids. Including olive oil as your staple oil and nuts, seeds will help provide monounsaturated fats and polyphenols, which are shown to be anti-inflammatory. The Mediterranean diet emphasizes a plant-based diet with daily consumption of fruit, vegetables, whole grains, beans, peas and other legumes, as well as healthy fats including extra virgin olive oil, nuts, seeds. Use herbs and spices to flavor foods instead of salt. Although the Mediterranean diet includes moderate consumption of wine, it is best for those with liver disease to avoid alcohol due to the impact on the liver. Another important component of the Mediterranean lifestyle is including daily physical activity. Animal proteins including fish, seafood, eggs, poultry should be consumed on a weekly basis. Very moderate amounts of sweets is also included on a weekly basis. Red meats and processed meats should be limited to monthly consumption. Which meals best represent the Mediterranean style of eating? 1 and 2 show 2 different breakfast meals. You can see that number 1 is more balanced with whole grain, protein sources and even some veggies, while number 2 is higher in refined carbohydrate in the form of a waffle and saturated fat with bacon. 3 and 4 shows 2 lunch options. Although both consist of a sandwich, number 3 has leaner meat, whole grain bread and a variety of vegetables with fiber. It is also visually more appealing with a variety of colors. 5 and 6 compare 2 different dinner with number 5 meeting the healthy plate guidelines. All of these are different variations of the balanced plate, even though they may look different. They all contain a variety of food groups with emphasis on vegetables and fruits, which provide powerful nutrients that reduce inflammation. A balanced plate provides the nutrients we need to thrive. It also helps us to feel energized and satiated after each meal. Thank you for watching this presentation. If you are looking for further nutrition information, the following websites are sources of credible and reliable information. If you would like to book an appointment with the dietitian, you can call the Liver Health Clinic.